Hi everyone, I'm Jonathan Davids. I'm DriverCheck's Corporate Medical Director. I'm out enjoying a lovely spring hike the day after Ontario's Chief Medical Officer of Health really confirmed what a lot of us already knew, that Ontario is now in its sixth wave of the pandemic. Now, this is not just true for Ontario, it's also true for provinces across the country. We're seeing increases in cases and hospitalizations, largely driven by the Omicron variant and its subvariant BA2. So, how do you keep yourself and your family safe while most provinces have removed a lot of the mandates that have kept us safe so far? Indoor masking, vaccine passports, capacity limits. Well, for one, get vaccinated. If you haven't been vaccinated, a 2-dose vaccine is important, but with Omicron evading most of that, you really need a 3rd dose booster. Some people need a 4th dose booster depending on their age and medical status. Secondly, it still makes really good sense to keep wearing masks. Despite provinces repealing mask mandates, when you're out of the house and indoors with other people where it's physically difficult to distance, wearing a high-grade medical mask really prevents transmission to others and also gives you some protection from acquiring this disease. Despite masks and vaccinations, some people still get symptoms. If you do, it's really important to have a good supply of rapid antigen tests. You should have a box in your medicine cabinet right beside your bottle of acetaminophen and your thermometer, so that if people do get symptoms, you can test quickly. Testing quickly allows you to know if you're positive. If you have a positive rapid antigen test, it means that you have COVID. You need to isolate, get in touch with your healthcare provider so that you can have access to a lot of the outpatient medical treatments available for COVID right now. Getting a negative rapid antigen test doesn't put you in the clear. It just means that we can't trust that well enough. You should still isolate and repeat your rapid antigen test a day or 2 days after that. Getting subsequent negative results gives you a little bit more clearance that you're likely not infected with COVID. You could have a non-COVID respiratory condition like the flu or a cold. So it still remains important that you isolate until your symptoms are done so that you don't expose others to that. So in the 6th wave, do all that you can, wear your mask, get your vaccines up to date, get your booster shots, stay healthy, stay safe.